So for a second lesson learned, I wanted to ask you, Steve, so when it came to scarring and why I came here, because unfortunately due to my weight training habits, my scars stretched because of me, not because of the work that was done on me. In your experience in this industry, and more than 37 years you've been doing this, what's your experience with scarring and what should be done? Like, should that happen?
Great question, Lance. This is something that has taken precedence, quite honestly, in the industry, where, especially with FUE coming into, I guess, over 10 years as one of the major choices in what type of procedure patients choose. The scar is something that is talked about in every presentation, in every conversation, with every patient, with every doctor, and we need to be clear about a few things. First of all, if you follow Lance's blog, if you follow some of the stuff I've put out online, you want to choose a clinic and a doctor, of course, that specialize in hair restoration or hair transplants. One of my favorite sayings is there's no such thing as minor surgery, there's just minor surgeons. Some of these doctors are just not good at it. So you need to make sure you do your research, and yes, you need to find a qualified surgeon that has many examples of the type of work he does. Now, with that being said, my second favorite saying, results may vary. There's different types of skin, there's different races, there's male, there's female. There's many different reasons why someone can get a different result in the suture line when it comes to the final healing of the scar. What you definitely want out of your hair transplant clinic and your hair transplant doctor is a guarantee of some sort on what he is going to do or she is going to do if you're unsatisfied with the scar. Simple as that. Now, Lance had come to the clinic in Austin where I do my work every day, and just to have some fun, and also because he's taken this so far, he wanted to see what it'd be like. He's a bodybuilder, a weightlifter, to fill in a scar that's stretched, and it blows my mind that with our technology today, we can then put in hair into a scar that's stretched out a little bit. So it wasn't the doctor that did his surgery that caused the scar to stretch. It's his body. It's his lifestyle. It's his working out. And what are we supposed to do? Tell a guy you can have a hair transplant and not go work out? It's just how you responded. So it's important to know that you're able to go into a clinic and say, hey, look, you've sent me and shown me many examples of fantastic suture lines that guys are wearing their hair in a 3-guard or a 4-guard or a 3.5 or whatnot. What are the guarantees that I'm going to have that result? Results may vary. There's no guarantee on how you're going to heal as long as the procedure was done properly, you follow the post-op instructions, what's going to happen if you should stretch out. So that's a question for all of you viewers out there to ask. You're asking your doctor, I understand you're great, I understand you do great work, and I like what I see, but what happens if I stretch a little? How are we going to take care of that? And that's the most important part for me.
Gotcha. So second lesson learned is, if you're active and you lift weights, chances are your scar might stretch. And if that's the case, make sure that you know ahead of time what your doctor can do for you should this happen. And if you were unhappy for whatever reason, something does not go your particular way or what you want in that surgery. So make sure that you always go with a doctor who only specializes in hair restoration, and make sure that he has a plan or has options for you on how to revise your scar should it not turn out how you want it to.